So most of the vaccines that are going to the counties that are most impacted. So I'll just let you know right now. And actually, let me maybe what I can do is I can just show you really quickly on the screen. You might be able, this might be useful. Let me just show you this. Can everybody see my slide or my screen?
Mm-hmm.
So as of just a few days ago, I think this is I think this is the latest information right now. So we see that we have 223 cases from Los Angeles. San Francisco has 215, 45 in Alameda, Santa Clara 34, Sacramento 29, Contra Costa 15, San Diego 13, Long Beach 9, San Mateo, Riverside, and Berkeley had 8, and then Sonoma had 5, and then it continues to go down here. And so, and we're anticipating, I'm going to go ahead and stop there. So currently, that's how the vaccines are going to be distributed. We're also holding back a smaller percentage of vaccines, about 15 to 20% of them. We're holding them back for special situations. And we do have our staff working with local health departments for those areas that have high risk activities, potential where infection might be occurring, but where we don't have a lot of cases. And so Marissa Ramos is on, and I think she may be able to tell you that we are going to be holding some webinars, town halls to increase our communication, and we will be working with your county to help increase vaccines to your site. But just to let you know, the majority of it is going to be going to those counties that are the most impacted. So let me and there's just a lot of activity happening at the state level. You know, every time we have a communicable disease, the state has to deal not just with diagnosis, treatment, prevention. We have to deal with infection control. There's a lot of work that's happening at the state level to get all of these things up and running. So in many ways, a lot of activity that goes into COVID is going into monkeypox, because it is a communicable disease. It's not going to be limited just to the communities of men who have sex with men. We know that it can be anybody can get it as long as you have physical contact with somebody who's infected, close physical contact, including contact in the household. And so we're anticipating and thinking ahead of what we're going to do to be able to slow down the transmission. Let me go ahead and stop there. And probably the best thing is to answer your questions, so that hopefully I'll be able to meet all your needs.
Great, thank you so much for that, Aragon. And it's encouraging to hear that you do have kind of that 15% set aside that could be used for situations like ours. Do you have a sense of when you'll be able to kind of decide how many you'll be able to send to this area initially?
Yes.
Happen?
Yeah. So I don't have the numbers in front. I don't have the numbers in front of me, but you get an idea just from the distribution of cases. Plus, there probably will have to work with your local health department if there's any additional vaccines that we can provide, just because of the amount of activity that you have down there. I don't have that. I don't have that at the moment. But that's the way that we're approaching this. And in the coming weeks, the vaccine supply will be increasing, and so we'll make sure that we'll get it out to everybody that needs it.
Yeah, I know we've all been watching the news, and
Yeah.
who follow this and know that the vaccines are coming. But the real concern is, because I think there's not a lot of testing going on, and anecdotally we're hearing on the ground that a lot of people aren't getting diagnosed as quickly. Their symptoms aren't being recognized, or they're not showing up as quote unquote classic monkeypox. So providers who've never seen this before, right, are naturally confusing it with syphilis or other things. It's another great pretender, if you will. So I think we're seeing the tip of the iceberg here. So we're really concerned that we could really explode here. And as we know, what happens in California, and in Palm Springs rather, doesn't stay in Palm Springs, and could really impact other cities in California, because most of the tourism is in-state, and could really impact the entire state. So,
could I ask a question?
Please.
Sure, somebody has their hand up, so let me take those. If you could use the hand feature, that'll help because we have so many people on the call. And also if any providers or the county officials have any questions for Dr. Aragon while he's here, this would be a great time. So first up, I see Jeffrey Mock. Go ahead.
Yes, my question is regarding to those people who have already had the smallpox vaccine, possibly decades ago. What is the latest information as far as the effectiveness of that against monkeypox?
So that's a really good question. And this came up to us on a CDC call this weekend. And the thinking is that if you had received the smallpox, the vaccine that probably the person received would have been what's called the Dryvax vaccine. They probably have some protection against monkeypox, but it's not going to be complete because vaccines wane. We do know there have been cases of people who are vaccinated who had the smallpox vaccine a while ago and still came down with monkeypox. But there is some protection.
Great, thank you. And Daniel Phelan had a question. Go ahead, Daniel.
So I guess I'm one of those 8 patients in Riverside County, and I'm curious to know if any contact has been made with the 8 cases that we know about, and has any support been volunteered to these people, including myself, in terms of getting a hold of any kind of treatment, Tpox or the vaccine, which has been very mysteriously unavailable through any resource that I've been in touch with. I mean, there's only 8 of us, so we should be on a first name basis. And there's how many people on this call? I mean, there's so many people working on this problem, and yet the 8 people who have the monkeypox cannot seem to get any action.
Yeah, so I see that. I know that you have local health officials are on the call. So I don't want to. I don't know what's happening on the ground there with respect to individual patient care. So I'll let the county answer that when they. I know they're going to be presenting a little bit later, so they can probably answer some of those questions.
I've been working round the clock for 5 days to try to get any kind of support for this.
Tomas, this is Kim. Maybe we can jump in here.
Sure. Go ahead. Hi, Kim.
Yeah. Hi, Dr. Aragon. Nice to see you. So Dr. Shavinsky or Misty or Barbara, can one of you address the follow-up that we're doing with individual patients so that we can kind of walk through our process?
Yes, I can start. Good afternoon or evening now, I guess. So the standard procedure, once we get the results back, sometimes even before, individual patients should be contacted. We provide results. Their healthcare provider have not provided it. If a person is already positive for monkeypox, of course, at that point, with the rash already present, it's usually looking towards treatment, not post-exposure prophylaxis. So I do have staff assigned to call each patient. If someone's been missed, we'll follow up with that, but people get called. We provide advice in terms of if they're having symptoms, how they might care for those. I think the biggest challenge is how do you get the Tpox? And that part I know is frustrating for people. So currently what I'm trying to do is get information about the healthcare provider for the patient. The patient cannot reach out for themselves to the treatment center and request it. It must be through their healthcare provider. So like I have a healthcare provider, I'm going to be calling in the morning and giving them the information they need to try and procure the Tpox for patients who have disease and need treatment. And then I'll defer to Dr. Dzimbinski about the next steps.
Sure, that is our general process for patients. One thing while Dr. Aragon is on, just to take the opportunity, just to share before we talk a little bit more about the general process. I know that we've been in touch also with other individuals at the CDPH level, but taking the opportunity to share about the sex tourism that happens in Palm Springs. And so I know that we have mentioned it before, but just to share that people come into the county and they may leave the county. So and this is something that we were going to go over in our report as well, that cases may not all be reported within Riverside County, though it may be possible that people come here, have exposures, or might be reported within other counties. In terms of the next steps of what the follow-up looks like, we have also put together a guide on supportive care. That is a new guide that will be posted to the website soon. And of course, if anybody on this chat is interested in seeing that supportive care guide, we'd be happy to circulate that. Provides information about how to help with soothing lesions that might be in the mouth or the throat, as well as sit spats that might help with any lesions that are around the anal or genital region. And so we're happy to provide that, but I would like to shift over to Misty to talk about what we're doing around Tpox, as there's been a lot changing over the past week in terms of the process from CDC. And Misty would be able to talk a little bit more about Tpox availability and the process on that.
Sure. Thank you, Dr. Shavinsky, and nice to see you, Dr. Aragon. We see each other multiple times during the week. Lovely to see you here too. Wanted to share that we have reached out to our providers who have received vaccine to share a refined process from CDC to be able to obtain Tpox treatments courses. We've helped with a couple of providers navigating their application, answered some technical advice questions. We've also been navigating putting in orders within the regional medical health system to have some pre-positioned Tpox to be able to deploy to providers. And we have actively engaged with the CDPH team for monkeypox to have a referral path for patients to get to existing Tpox treatment centers that are in other counties. The closest to us in Los Angeles County. The LA County team has opened up their process to assist with individual patients. There is an informed consent process that the patients engage in, and then a process to get up to a Tpox treatment center. We are also working with expanding that treatment network beyond vaccine providers to include the county hospital, federally qualified health clinics to help with the patients who have no healthcare provider or are uninsured or underinsured. And then we've also been working with our own RUHS EIP clinic to become a Tpox provider. So we've also tried to pre-position orders for the facilities that are navigating their application so that they could have the treatment on site as a referral network that we're building out. So I hope that helps provide some additional context.
Okay, thank you. It sounds like we've got a ways to go. We're making progress. So Dr. Kakar had asked if the numbers that Dr. Aragon had presented, were those people diagnosed before or after the commercial testing that started last week? And then how are those commercial lab numbers getting back to the state and to the county to update your numbers and closer to real time?
Yeah, so I showed you the latest numbers that I have that were dated July 26th. And there is, I don't have the laboratory numbers with me, but there are, the commercial labs are now doing testing. So there's quite a bit of testing happening now in the community. So the clinicians should have access through their normal laboratory networks to be able to submit specimens.
And I think the question was, how are those diagnoses from commercial labs getting to you and to the county to update our numbers? Because
yeah, so
everybody thinks that, you know, the number seems suspiciously low for Palm Springs. So we're wondering if there's a lag in reporting.
No, we get those right. We get those right away. Those get reported to us. These big, especially the big laboratories, we get reported to that all gets reported electronically. Okay. So there's that. The lab comes really fast. I think probably one of the challenges, well, the way labs get reported is that, as was mentioned earlier, it gets reported and followed by the county of residence. So that's where, so you may have a lot. So if there's a tourism place and people are coming from out of county, they're not going to get they're going to get reported at the county where they live. And so that's what that may be one of the reasons why you may be seeing a smaller number of cases for Riverside.
And is there a way to capture that? I know there's a form that clinicians had to fill out when they're submitting samples. Can they say not only what county they're from, but if the person suspects they acquired the infection somewhere else, to somehow record that so we have at least some sense of this kind of tourism and how that's affecting things?
Yeah, that's a good question. I think right now that's going to be challenging to get that. I think we sort of have to, I think we have to use our common sense. And this is why it's important for us to hear from the community, because you're on the ground, you know what's happening. And if you know that there's a significant amount of sex tourism happening in your community, then we want to partner with you to do everything we can to decrease transmission.
Great, thank you. Dr. Barber, you had a question.
I was just going to make the comment. Our pharmacy at Borrego is working to get a supply of Tpox. It's a very laborious process, and they're hoping to get an emergency supply, and that can go through. Now that will be available. Our pharmacy will also be available to other providers. So yeah, we have our own pharmacy at Borrego, but if an outside provider, say Dr. Ritchie or so, we needed it, it would be available through our pharmacy. So it's not just limited to us, but we're trying to work on that to get emergency supply and get on board. It's just a very long process, as Misty has outlined. We're working on that. The other thing I want to remind people is the vaccine is not 100%. The vaccine, the data I've seen, is only about 70 to 78% effective. I don't know if the public health has gotten any other data, but that's what I've read in most of the studies. So we still need to talk to people about limiting their exposures, because the vaccine's not a panacea. It's not going to fix everything.
Very good to know. Thank you. Yeah, no, that information is not getting out there. I don't think people have been seeing that. So that's an important thing for messaging. Barbara Cole, go ahead.
Yes, so I did want to comment on reporting. So all the laboratories are required to report electronically through our disease reporting system called CalReady, but it comes through ELR. So we get it from the labs as well as providers, the healthcare provider reports. We get it two ways. So Dr. Aragon, I want to touch base. We have a different count, and so we can reconcile our number. What we're showing us today, based on what came through ELR, was that we had a total of 15 probable cases, 3 confirmed, for a total of 18. So maybe I can touch base with you offline so we can reconcile our numbers.
Yeah, so it's great. It's really important to the locals are always going to have the most latest information. Thank you, Barbara.
You're welcome.
Thank you. There's a quick question in the chat from Trent Rodas over at DAP. What are the indications for Tpox treatments?
So I don't know if you, Barbara, do you have one of your clinicians on the call that can summarize that for them?
I can. In terms of indications for Tpox, primarily it's like those that are immunocompromised. So those that immune systems might be weakened. So that might be those people that might have HIV that are not on medications, or AIDS, or are immunocompromised because of medications that they're on, or because of other types of conditions that they might have. It also includes people that might have some underlying skin condition, so like a psoriasis or other kinds of skin lesions, which might complicate presentation of monkeypox. There's also additional guidance that we have on our website from the CDC on those that would qualify for Tpox, and I'm happy to provide a link to that in the chat that helps to explain essentially those that would be at risk for severe disease from monkeypox. In that category, also considerations for children, pregnant women. So there's some other more specifics within there, but I will post that link in the chat. And then perhaps when there is a moment, I can also share my screen with the symptom guide. I realize there's no way for me to upload it into the chat. So perhaps after this chain of conversation, I can share my screen and people can take a screenshot real quick.
So you should be able to upload documents. If you go to the chat box, there's a little document icon on the right-hand side. If you click on that, it would allow you to you
I
said it's-
saw Dropbox, Microsoft OneDrive, Google Drive. It looked like I had to connect to something that I couldn't directly
Oh.
upload it.
Oh, okay.
But maybe I can work on trying to figure that out though.
Okay. Yeah, just throw it in Dropbox and then send. So Dr. Ritchie, I think you had a follow-up call about a follow-up question about the Tpox.
Yeah, thank you. Hi, Dr. Aragon. We were on a call today with Dr. Deskalakis from the CDC and spoke about Palm Springs, and he was pretty, Jeff, I thought he was pretty taken aback that we haven't been given more doses because of our transitory nature here in Palm Springs. So I really appreciate what you said, but I'm not quite sure. Are you committing that you will send a more appropriate amount allocated to Palm Springs when you get them, because of the nature of our city and who lives here and why we need it, et cetera?
Yeah, so the major criteria we're using is places that have the most cases, and we're holding back 15 to 20% that we can use for other places that have special circumstances like Palm Springs. And so given the amount of activity you have, I know that we'll work with your local health department to make sure you get some additional doses. I can't tell you right now. I can't tell you what that amount is, but we do recognize that there are areas that's high risk activity that may not have a lot of cases at the moment.
Okay, because the only additional thing I wanted to mention was that I've gotten quite a few phone calls from colleagues about testing and how to test, and it's just, I think that we're way underreporting because the patients aren't being tested here, just to let you know that.
You guys know what the process is for the tests and how long it takes to get the results back? 'Cause I can tell you if you don't.
Yeah.
I can let you know if you don't.
So what I understand from the meetings that I've been in, it takes anywhere from sometimes 1 to up to a few days, depending on who's doing the testing. Some laboratories are quicker than others, but it's not like you go in and you're going to have the test the same. You're going to have the results the same day. More typically, you're going to have to wait.
I got my swab on Saturday. It was told on Monday it would go to San Bernardino and then St. Louis and then Atlanta. And that hopefully if a positive result popped out of one of those cities, that would be reported back to Barbara and she would be able to start some balls rolling. Since the vaccine is going to be so delayed in getting here in any kind of quantity, we're probably looking at a pretty heavy treatment load on the horizon. If we are going to get some emergency help or emergency doses of Tpox, it would be nice, it would be helpful for those of us who are already on the train to be identified as people who could get their hands on that treatment. Because thousands of people are going to one place at the CDC in Atlanta to apply for treatment. So I'm in a stack in Atlanta. Then who knows where the drug is to be transported out to the West Coast to get into our bodies. These are doubling every day. I had 2 on Friday. I had 8 on Saturday. I've got 14 this morning in my mouth, my neck, and my face. And I'll wake up tomorrow morning to how many more, I don't know. I've seen many of the people on this call. I've talked to Barbara several times. Everybody's doing what they can. There's a lot of global big things happening, but on the ground, the 8 or the 13 or the now 19 of us that have it, we're not getting a whole lot of anything. I can tell you that. All I would ask is, if we are going to get some Tpox into this valley, that maybe we take the list of people we already know that have it and try to fast track them.
David, I know you had something to add to this as well. Go ahead.
I wanted to scream before I turned on unmuted myself. Daniel, thank you so much for being here. It really means a lot to me to see you show up in this space like this. Thank you. Listen, I sent Jeff a private message because I wanted to make sure that I got to speak before the state left. The county and all of us in this town hall can sit in these groups week after week and discuss about what we can do and what we're trying to do and how we're trying to do this. And still the same problem remains week after week, that there's no vaccine available for us because our numbers aren't high enough. And here's the problem that I have that is really infuriating. It is the lack. It's the inertia. It's the constant inertia. It's the idea that we need to have some kind of number in order to get in front of this situation. So we are a hot spot. And I know the county's been working their tail off. I know that Jeff and all of us as a community have been busting our tails to try to get the word out, messaging, and all of these little nuanced things. But what's not happening, what I'm really upset about, what I'm really infuriated about, what's not happening is that nobody is talking, or if anybody's talking, there is no movement from CDC or the Fed or the allocation that's coming to Palm Springs. And we are not getting in front of this thing in time. I have 3 friends in my own neighborhood right now who are infected with monkeypox. So I know for a fact that those numbers aren't true. There's no possible way that I know 50% of the people that have monkeypox in Riverside County right now. There's no way. I'm just really, I'm encouraged by the county. I'm encouraged by all the hard work that everybody's doing, but the state needs to be screaming their head off at the feds to be getting us to get in front of it, not to take care of what we already have. But there are hundreds of people every single day who are contacting me, contacting friends. We're all planning and driving to other cities and lying and making up stories and trying to get skin to skin contact post exposure prophylaxis vaccination. And we shouldn't have to be doing that. This vaccine should be here right now. And I know that I sent you the story in the New York Times about the 300 doses that sat while we did the wait and see to see how many cases came while gay men and LGBT people are infected with monkeypox. And we have an opportunity right now to get in front of this, but we can't, the county can't do it without the state actively going to the feds and saying, we have to have more vaccine yesterday. And that is my area of contention. And I just wanted to make sure that I said that to you, Thomas, so that you know, I'm sure you have a fire lit under you right now to get this thing done. But I am so angry and I'm so at my wit's end because we shouldn't have to be manipulating county and lying and sharing pictures among one another so that people, so we can prove that we touched somebody with monkeypox. We should have this vaccine now. There are thousands and thousands of doses in places that it doesn't need to be. And we need to allocate the dosage correctly so that the people in this county get vaccinated. And it may not be a cure-all, but it's a start. And we have to show that we're doing that. So that's all I'm going to say on this call, but I just really wanted to feel heard and seen today. And I also wanted to thank you very much for coming here.
Great. Thank you, David. I think you highlighted a really good point that, you know, Provincetown and Fire Island are 2 very similar places where they did manage to work with, you know, their local and state authorities to get extra doses and do a more effective job than we've done here. So we're kind of behind the 8 ball.
So Jeff, I'm gonna have to check off. I want to just thank everybody for sharing with me your concerns. I hear you. It's important for us. I'm glad that you're well organized, and it sounds like you're doing all the right things, and that hearing your stories does help me. So I'll stay connected to Jeff. And we'll continue to meet and do everything we can to make sure that we get you more vaccine. I'll also follow up on the treatment as well. So again, thank you so much. And Jeff, again, thank you for reaching out to me early on. I think you were one of the first people that reached out to me. So I really appreciate you doing that and everything that you're doing for your community.
Great. Thank you for joining us. And yeah, we'll be following up. And if there are any other things that come up on today's call, we'll let Marissa know and she can bring those back to you.
Okay. Thank you, everyone.
Well, thank you, everyone. Yeah, I wasn't sure if he was going to be able to join tonight or not. So that was a pleasant surprise. I've been pestering him endlessly. So you need to be here. You need to be here. And to his credit, he did. So hopefully that was heard. And I know as Dr. Ritchie mentioned earlier, we were on a call earlier with Dimitri Daskalakis, who's head of the HIV prevention branch at CDC, which is taken on the monkeypox. And so I think we'll maybe hook those two up and say we talked, and hopefully that will help move the needle. So I wanted to, because we're kind of 40 minutes in, give the local vaccinating clinics a chance to kind of talk about what it's like on the ground there, who's getting the vaccine, kind of what their future plans are, if they have treatment and if they're able to access it. So maybe I'll go in alphabetical order and start with Dr. Barber at Borrego. Let's see if I can find out.
We've been reaching out to all the patients who meet the guidelines and stuff. So we've used, I think, about a third of the vaccine we've so far, but we have a lot of patients coming in the next few days. There are a lot of patients who want vaccine. They didn't meet the guidelines. So I'm waiting for those to be updated by the county because we're sort of ethically, I need to follow the guidelines the county is saying. I have patients come in and want the vaccine. I'd love to give it to them, but it's not fair because I know I have patients and I know Dr. Ritchie has patients. Everybody has patients who want the vaccine, but we're all in the same boat. We have to follow that. So I'm hoping the guidelines be expanded soon so we can make that available to more people. I know that's really going to be restricted by the availability of the vaccine, but we're actively vaccinating as many people as we can. I think, I'm not sure, we did a lot today. There's people coming in, a lot of people coming in to be tested for monkeypox. And I think I want people to come in to get tested. I think a lot of people are overreacting because I've seen probably 2/3 of the ones I've seen today. I said, most likely you don't have monkeypox. I recommend they do continue to isolate. We did the cultures, but you know, it's from what I've seen, it's not that common. But I know there's cases out there, not trying to minimize it. And I want people to come in if they do have symptoms. But right now I'm just waiting for the work in the county when we can expand the vaccines to other groups.
Great, thank you, Dr. Barber. And one question I'm asking all of the vaccinating clinics is, so your procedure is to reach out to your own internal clinic patients, and you're not able to provide it for people who may meet the criteria but are not Borrego patients? How is that working?
Based on the guidelines, we don't know who these people are because I don't know the county. It might have been better to have some of the vaccine to go to Riverside, University of California, Riverside's medical campus because they have more access to the county because the county has all the records for everybody who's been diagnosed with syphilis or gonorrhea in the last 6 months or year. I only know the patients that come to my office or to our offices and stuff. So we reached out to other clinics in the Borrego system and stuff. We've got 7 clinics in Riverside County. So we reached out to all the other clinics that take care of patients, not just the patients at Stonewall. But I don't have the data for patients who tested positive for syphilis or gonorrhea in the last, several months, or whatever, to treat those patients. The patients that have a known contact or the possible exposure, those patients can come into any Borrego clinic, and those patients can be directed from that clinic to the Stonewall clinic because again, there's 7 clinics for Borrego in Coachella Valley. And I can't see everybody.
And then, I know it's the access to STI testing records. Now, if somebody has access to their own records, a lot of us could download those off of MyChart or whatever, or we get paper copies. If someone were to bring those in, and I'll ask this of the other sites as well, would that be sufficient documentation, or do you still need to go through the county to verify that?
Well, if we have unfortunately, all things can be falsified. The documentation, we can check with the county and call them and verify the results and stuff. I think if somebody has a copy of a test, we could treat them. The problem is if they're not a client of Borrego, they have to become registered, and making an appointment is a laborious process. But like they can come to any of the Borrego clinics, and then they can be directed to the Stonewall Clinic, because only the Stonewall of the 7 clinics, only the Stonewall Clinic in the city has the vaccine.
Right. Okay, thank you. Dr. Javinsky, was there something you wanted to add?
Oh, I was just going to comment that we in partnership with each of the clinics that do have vaccine, they are encouraged to take on other people outside of their network as able, meaning that if there are people that do meet the criteria, that the appointments are available, that it is encouraged. And of course, there might be some challenges with working that out, but we're happy to work through clinics to help them get a system in order to be able to do that. One item that we have been working on and that we can discuss further on the provider calls is helping with a referral system such that healthcare providers could sign off on their patients, they meet this criteria, and then get that form over to the clinics to ease the process. So in terms of the referrals, we're certainly happy to help with trying to help with that stream, but we definitely encourage that if their appointments are available, that people outside of the network are also taken.
Great, thank you so much for that. So let's turn next to, in alphabetical order would be DAP Health. Is there someone on from DAP Health who could speak to how vaccination is working there so far?
Sure, I can speak to it. This is David Lee. I'm the Director of Nursing. So we have, as of this afternoon, given about 75% of all our vaccines, and the rest are going to be given tomorrow. We did follow the same criteria as Dr. Barber, where we started with our own patients that were either DAP patients or patients that were seen in our STI clinic. And we'll also see, I know Trent, who's also on the call, as he's getting and treating patients that are coming in through the STI clinic, he's also doing, giving them the monkeypox vaccine. But like I said, we've started a mass vaccine clinic in the afternoons. And as of tomorrow, we've gone through all 180 doses of our vaccine.
And so to be clear, initially everybody was given, so for you, it would have been 90 courses of treatment. And then I think shortly thereafter, the county approved using them all because we knew more vaccines would be coming along for the second dose, which is supposed to be administered, I guess, 4 weeks later, correct?
Correct. I spoke with Missy and so forth, and they advised us to go ahead and give all of them as first doses.
Great, thank you. And then a
You're
quick
welcome.
follow-up question for Misty or Jennifer. So what's the current guideline for second doses? Are they going to try to get everybody a first dose in everybody first, and then so kind of push out that 4-week window, or what's the?
It's a great question, Jeff. I appreciate you asking. So the minimum interval between doses is 28 days, but the priority is as many first doses as we are able. That helps us demonstrate utilization so that we could drive additional allocations, because part of the allocation strategy does now include utilization to avoid counties stockpiling or hoarding the doses and sitting on a shelf. We're trying to avoid that. We don't want to have that. So we have asked all of our partners to prioritize first doses to drive additional allocations.
Great, thank you for clarifying that. And then I guess the same question about Tpox for DAP as well. How is that working? Are you able to give it to people who present with symptoms? And how is that? How's the whole process working for you?
So we're still working with the county on that process. I'm going to defer to Trent because I know he's been sort of dealing with it. Trent, do you have any comment on Tpox?
Haven't really seen anyone who had such severity or met any of the criteria that Dr. Chavinsky just shared with us, that thought they needed treatment. It's just been a long course for many of them. Topical pain relief and just over-the-counter medication is all that the ones that we have nobody's really asked for Tpox. We had one patient that did. I haven't really gotten good direction from the county on how to do that. We wrote a prescription for it, but there wasn't good direction on how to get that back to the county or from our pharmacy. But in general, the ones we have seen have not required treatment or met any of the criteria for it.
Great, thank you.
Wow.
Jennifer's hand pop up again now. Go ahead.
Sorry, and Misty might be better at responding to this because we have been navigating the Tpox process with many clinics, DAP included in terms of, but I think what to share across the country right now, there has been feedback to the CDC, to the state, that the Tpox process is challenging on healthcare providers. So right now, as Misty outlined, it does require a healthcare provider to start the ball rolling, start the process, to fill out the paperwork. It requires a few different visits that need to happen. CDC has recently said that those could be virtual as well, but it is paperwork. It is a process in terms of healthcare providers submitting that stuff in order to have Tpox. With that said, it is a process that we're encouraging all those that are able to start on, because we know that it's a matter of time. We know that it's not only a matter of time, but there are patients yesterday, today, tomorrow, within the next week that could be asking for it. And we're trying to ensure that even facilities that perhaps people aren't asking about it now, but they might very soon, and making sure that we have the ability to provide that as soon as possible. But I think that feedback all around about it being challenging to access Tpox because of the paperwork and because of the process starting at the level of the healthcare provider and signing off those different forms. However, we're happy to work with any clinic, any healthcare provider who has a patient that's eligible to get those papers filled out and sent in.
Oh my God, this is the paperwork that goes down, okay? I've been filling it out for 2 days. I'm HIV positive. I'm 63 years old. I'm a gay man living in Rancho Mirage. I have 14 lesions on my body. I can't send it in. It's an intake form. It's a patient information form. It's my prescription records, and it's the protocol. I can't personally send it in. This is driving me nuts. I have to get off the call because I don't want to interrupt you people anymore. But I got to tell you, on the ground, it ain't happening. This gentleman who was just on the call, who said he hasn't seen anybody that qualifies for Tpox or that he has to pursue for Tpox. Oh my God, what's your number? How do we get in touch? I think I qualify. My infectious disease doctor diagnosed it as monkeypox. But when the test results will come back, who the hell knows? I've got the documents, I've got the protocol. I can't send it in because I'm a patient. Sorry. It's very frustrating.
Any suggestions?
Well, I would say anybody who's going through this frustration, either one, have their healthcare provider reach out to us so we can help them get that paperwork in. If they're having difficulty filling out that paperwork, we're happy to help them walk through it. Unfortunately, that part is not within our control. Unfortunately, the setup of it, because of how Tpox is being sent through the national stockpile. There's no EUA on it. There's limitations on that front. If somebody is looking for a healthcare provider, if we can help make some connections that way, we're also, happy to try and help on that front, or, trying to get somebody to the right place. But I do recognize it's a challenge, and I do want to personally thank, we have, somebody on this call, we've had people on previous calls that come in and talk about their personal experiences. And, I really appreciate that, because I think there's nothing that's served by keeping things in silos or keeping things quiet. And of course, anybody at their comfort level, but I think the more we can amplify information and fix processes, that's what needs to happen.
Great, thank you for that. And Dr. Kirkar, who's at both DAP and Desert Regional, wrote that it's 126 pages of paperwork to get through it. So you can only imagine what a burden that is on the providers, right? They've already got a busy clinic, and they're having to do all this. So hopefully we can, maybe that's something to take up with Dr. Daskalakis at the CDC, is to see if there's a way to streamline that process. As we're hearing, it's not working, right? So thank you, Daniel, for sharing this. We really appreciate this. So I wanted to turn next to Eisenhower, because they're the third vaccinated clinic, and if there's someone on who could speak to how it's working there at Eisenhower.
Hi, good evening. It's Christine Johnstone, VP for the Ambulatory Division at Eisenhower. And we are approximately 80% through our allocation. We should be completed in the next 2 days. In our clinics, we have 3 clinics where we're really primarily focusing in Palm Springs. We did obtain the application for Tpox today, and one of our infectious disease specialists has stepped up to complete that process, Dr. Gauthier, so we're appreciative of that. So we're looking next to treatment, and we are having some challenges with our commercial lab and getting Quest swabs, so that is one challenge that we're seeing. But again, very eager to get more vaccine. We have a number of patients walking into our clinics, just dozens of phone calls, every hour throughout the day, seeking the vaccine and treatment. So very interested to move forward.
Great, thank you so much for sharing that. And then would I be correct in assuming that you're like the other sites and you're reaching out to your own patients, and if people walk in and they meet the criteria, are they able to access the vaccine? If they're not,
we have a large patients in our health system that would qualify, so we have no shortage right now of patients, of primary care providers that have either self-identified or our PCPs have identified them as qualifying. So we definitely have no shortage right now.
Great, thank you. For some reason I keep getting messages from Dr. Kirkar as private messages, but I'm going to share those. She's asking if pharmacists can help speeding up access to Tpox, if there's anything they can do on their end.
So a pharmacist, any provider that's qualified to navigate the assessment and write out the prescription could participate in in enrolling as a Tpox provider. So there does tend to need to be a partnership between a pharmacist and some type of clinical provider to do the assessment piece. And we have had a couple of pharmacists navigate this, but if the broader question is, can the medication just go to a pharmacy to be picked up off of a drugstore shelf? The answer to that, unfortunately, at this particular time is no. But we have had some providers navigate successfully with telehealth services, and we've been working with CDPH to try to expand that type of outreach.
Great.
As well. But we welcome providers.
You're cutting out honestly. I don't know if there's something else you wanted to add.
No, that's it, Jeff. Sorry about that. Thanks.
Thank you, no worries. Bandwidth is an issue in a lot of ways. So I see a question that's been hanging out for a while from Jonathan. So before we go on to kind of the next step, we'll take that question. Go ahead, Jonathan.
Thank you. Has anyone thought to collect data on those people who've had the herpes zoster vaccine? If there's any residual effect?
asking if there's any protective effect that's from the herpes zoster vaccine. That's an interesting question. I haven't seen any clinical literature that shows any protective effect from either the varicella for shingles or chickenpox vaccines or any others. There's maybe some other clinicians on the call have additional insight, maybe literature they've seen.
Is anyone collecting that data though?
We are inquiring of vaccine status, yes, to determine what vaccine somebody has had, and then their medical history.
Great, thank you.
With regard to disease processing that's being collected.
Thank you. So I guess this kind of segues into the whole surveillance question, right? So how is surveillance working? I know there's a shortage of tests and getting those back in real time. But I think especially in high prevalence communities like ours, kind of figuring out what that is and not just testing active cases, but when more tests become available, doing more widespread testing to see if there's a lot of undiagnosed infection going on, asymptomatic infection, just like we had with COVID, right? At first they were only testing, and that really put us behind the 8 ball because there was a lot of asymptomatic transmission happening, and it really spread out of control. So we don't want to see that happen here. So someone could speak to that, the surveillance efforts.
Well, I can share in terms of surveillance efforts. If you're talking about, for instance, wastewater surveillance, I know that is still being looked into and pursued from the city of Palm Springs and from those testing services, but I have not heard a further update in terms of that starting quite yet. But it looks like we might have somebody on the call that can speak more to that. So I'll pass that off to Lauren.
Thank you. Yeah, so the city is working on that. We don't have any updates, but they have begun the process. So, we're working with GT Molecular, which is the same company that's doing the COVID wastewater surveillance. So it's in the early stages of development, but they are working on developing a process for testing, for monkeypox. And so we're hoping that we can test for it soon. But all I can really say is that they are working on that process.
Great, thank you, Lauren. So there is a commercially available test out there that they can utilize. It's just putting the process in place.
Yes, I don't, again, I mean, I believe the company doesn't want to release too many details, but that they are working on, I don't know that this kind of surveillance of monkeypox has been done in wastewater before. Again, I don't want to speak out of turn about things that I don't really know. I just, the update I do have is that the process is underway, so that they are developing the method to test for it. And then, if you want me to update from Councilmember Polstage's office as well, I can do that, or I can come back to it.
No, please, that'd be great. Go ahead.
Okay, so just, as I know everyone is aware, the city did send that letter to Director Aragon last Wednesday, asking that the state re-examine the formula for vaccine allocation. We've gotten a response to that, and as we've seen, we're in a dialogue there. And then in the meantime, Councilmember Christy Holstage, I work for her office, by the way, for just so everyone knows, she has wanted to be here but was not able to, so I am here on her behalf. She has been working closely with DAP Health and also with Senator Scott Weiner and Assemblymember Evan Lowe and the LGBT caucus on our advocacy efforts. She's also working with Senator Julian Cyr, who is in the state legislature of Massachusetts, who represents Provincetown. So he's helping advise us on, how the best way to get a bigger vaccine allocation for our region. And that's really the only update I have right now. I can just say that this is very, very much a priority for our office, and that we really appreciate all of the work that's being done, and especially the community leadership that we're seeing, and all of the work from our healthcare providers in the county. And then I'm going to put my email address and hers in the chat, and anyone is welcome to reach out to us. So thank you, Jeff, for putting this together.
No, thank you for this update, and great to hear that you've reached out to the folks in Provincetown. We keep quoting that as an example, so thank you for
Yes, Christy,
find ways
yeah,
to-
Christy is in dialogue with Senator Sears. She's already taking meetings with him and working with Senator Weiner as well.
Excellent. Thank you so much. Did we have any other questions from folks in the call? Yeah, and I think, circling back to the surveillance question. So will there be plans at some point, like we've done with COVID, to do mass, well, not mass, but, community-wide testing, going to the venues and so forth to get a better sense of what the overall infection rate is, even if they're not showing up as frank, symptomatic cases?
So I can maybe start on that one. So in order to be able to do something like that, we would have to be able to do like a blood test or something along those lines in order to check and see for exposure. So that's something we can pass on to the state and see if any test is available to do something like that. Because for surveillance study, of course, swabbing lesions wouldn't be possible. The people wouldn't have lesions, but the ideal would be to be able to study those that have had past infection, and like an IgG, for instance, something that shows past and recovery, to see how many people have been exposed to that. So we can follow up, see if anywhere else is doing that, see if there's any test available to do something like that, to get better information there on exposures across. I have not at this point heard of any of that test.
Okay, thanks. Well, that might be a question for Dr. Aragon as well. See what their plans are. But I think, that there's concerns that this could become endemic in the MSM community. So there's, a sense of urgency in terms of finding ways to measure the true scope of what's going on, so we can control it.
I was wondering if I might be able to share my screen and show that symptom guide.
Oh, absolutely. Please go ahead.
Let me see if I can figure out how to do that. 1 second. Share screen. Okay. Be able to see the guide over here.
Now we can. There you go. Just to say, make it a little bigger for older eyes. It's Palm Springs. We're getting gray.
I'll make it bigger and talk through it really briefly. And then I wanted to reach back around to the Tpox situation, because, it's a start of a conversation, but it's not a finish of a conversation. And so first I'll go over this, and then I want to wrap back to that. So for the supportive home care guide, some information that we are recommending is keeping rashes clean and dry when not showering or bathing to prevent bacterial infections, to stay hydrated during the illness, especially if someone's also experiencing diarrhea or vomiting. For painful genital and anorectal lesions or inflamed prostate, a warm sitz bath lasting at least 10 minutes several times a day may help with pain and inflammation. And at the bottom, we describe what a sitz bath is. So I'll get there too. To consider over-the-counter medications options as needed. So for pain and fever, acetaminophen, ibuprofen. For itchiness, over-the-counter antihistamine medications, calamine lotion, or petroleum jelly. For lesions in the mouth, chlorhexidine mouthwash can help keep lesions clean to prevent further inflammation or infection. For nausea and vomiting, there's over-the-counter anti-nausea or nausea relief medication. For inflamed prostate, stool softeners can help because it can relieve the pain or pressure when using the restroom. And then also helpful to talk with a healthcare provider about prescription medications. What we were hearing so far in terms of hospitalization is that for some people, it is severity of disease in terms of immunocompromised status and the disease getting severe. But for many of them, it might be uncontrolled symptoms. So the experience of monkeypox, I'm sure others can attest, is not pleasant. It's quite the opposite. It can be painful, uncomfortable, sitting, drinking liquids, any amount of it can cause discomfort. So the symptom management component becomes very important, and then in conjunction with, if those are for those who are eligible, also the Tpox. So in terms of the prescriptions, Magic or Miracle mouthwash or numbing gels may help with pain from mouth lesions. And the hope for this guide is that people can also go to their healthcare provider with it, because healthcare providers, they're also learning about monkeypox, and they might not have all of this information yet, or they might not realize what might be helpful. But some of these things that if they're prescribed could potentially be helpful. There's anti-nausea medication like Zofran, or constipation medications, numbing gels, which may be able to help with rectal or genital pain, and then antibiotics if somebody develops a bacterial skin infection. Another consideration, just because the data that we have so far is around a third of those that are testing positive for monkeypox might also might be testing positive for another STI. So also getting that testing done as well. And then contacting a healthcare provider if you're experiencing bleeding from the rectum or experiencing other concerning symptoms, which are not helped by home care practices. And this just explains a little bit more about what a sitz bath is. Essentially, you can do it, the bath, either in a tub with the water, filled up just enough so that way your bottom and your anus general area are covered. It doesn't necessarily take a lot of water, just a couple inches, but the main part is, although for relaxation, some of us might enjoy bubble baths and things like that. For this kind of thing, for sitz bath, you don't want to be adding the shower gel or the bubble bath or any type of soap, because it can be a further irritant. And so it would really just be that water and in order to avoid any other kind of additional irritation. The water temperature should be lukewarm or comfortable to the touch. And you can soak up to 3 times a day for 10 to 15 minutes, or a couple times more throughout the day if it's helpful. So this is just some instructions about filling up the bathtub in order to do it. The important part is also, when you're done, you want to make sure that you gently pat those areas dry using a soft towel. Anything that stays wet or moist can lead to infection brewing. So you want to make sure to dry off afterwards. And then there are also, if a tub is not an option, so if you don't have a tub in your place, another option is medical supply stores or pharmacies also sell small plastic tubs or basins that fit over a toilet seat that can be used for a sitz bath, and that can be filled up with water as well. So these are some of the symptom management strategies for those that may not qualify or that are having symptoms that are uncomfortable or otherwise might be considered severe, that these can potentially help with. But I want to loop back around to the Tpox front as well, and say that this is a partnership. It's public health, of course, with the community, with the healthcare providers. And I think this is, shows an area where we really need to come together. We've put that ask out for centers to come on for Tpox. I know that they're in the process, but I think, as we've heard on this call, it needs to happen as soon as possible. We are working on that from the county side to help healthcare providers, but also putting a call out to any other healthcare providers that wants to be able to provide this for their patients to please, if we haven't reached out to you yet, please reach out to us, so that way we can make this possible and we can get people the treatment that they do need. So that's where I'm gonna, I guess, stop on that. But if Misty, if there's anything else that you wanted to add.
One of the symptoms that you're missing on your list is thrush and sores, monkeypox in the mouth, and the difficulty with speaking, chewing, drinking, swallowing, and sleeping.
So we can add.
For those of you who are old enough to remember when Kaposi sarcoma was around and people had thrush in the mouth and they had KS sores, it's the same thing. If you've ever had a canker sore in your mouth and you bit down on it hard, that's what it's like. And it doesn't stop. It's constant. So trying to drink water or chew food, it's absurd. So, that's what we have. That's what we deal with. And these are all, great ideas for symptom relief. But what I've read about Tpox is it's the only antiviral that's been shown to reduce the symptoms within 48 hours, reduce the length of time for the total cycle of the illness, and to give any kind of relief from a medical standpoint that truly ends this little nightmare that those of us who have it are going through.
Thank you. Thank you for sharing that. And I think that's where, you know, we all go back to advocating and to make this process easier on healthcare providers, easier on patients, to try and get the treatment out there for people who really do need it. I'm so appreciative, Daniel, that you're on this call to share and to get the information out to the community, because sometimes when people don't see what it looks like, they don't hear it, it's hard to connect with it. And exactly. So
Take a good look. They hurt nonstop. They're sensitive to the touch. The other thing is that it's 100% alone, 100% quarantine. Nobody can touch your kitchen. Nobody can touch your towels or your sheets. Nobody can clean your house.
Yeah. And it's also, you know, it's other guidance that we give out is pets too. A lot of people, I mean, I have a pet and I'm very close with my pet. And if you get monkeypox, the guidance is also to stay away from the pet during that time. And that's further isolating. So I think we don't want to see any more monkeypox cases, but the truth is we know that it's going to happen and we know that people have it now. So we need to come together. We need to come.
It's coming, and there's a lot of healthcare providers on this call and a lot of community organizers and a lot of people that have worked their whole lives and careers to face these kinds of situations. But it has to be a balance between the global, big structural organizational efforts and the on-the-ground support for the 15 people who have it.
And probably more.
And I've spent probably 15 hours at Eisenhower since last week. Nothing. Warm compresses. Write it out. Look, they're already crusting over. You're almost through it. Bullshit.
So I know there are some Eisenhower providers on the phone. I know one gave an update a little while ago. Perhaps one of those could reach out to Daniel and help him navigate the system there at Eisenhower, so we can so at least he can find some personal relief. Because yeah, this, as he says, this shouldn't be happening. And I know advocating for Tpox would be important. Yeah, was somebody's going to chime in?
Hi, this is Christine with Eisenhower Health. I just reached out to Daniel now that he identified himself as an Eisenhower patient. I'm glad to try and assist him if possible. I'll provide my phone number.
Terrific. Thank you so much. So there was another question. I hope I didn't miss it in the chat. But I think the other thing we wanted to, oh yeah, go ahead. Tony Dorsey, Dr. Dorsey, go ahead.
Yeah, I posted it in the chat a little bit ago. I'm just curious, are the counties willing to do any kind of support systems for enabling services, i.e. a community health worker or other on the ground stuff? Because I mean, you know, Daniel's not the only one, but it's probably a high point of contact there that needs to be made to help some of those services. Is there any support for perhaps being able to create a role within a lot of the agencies for a community health worker? And can we do that on a high-speed basis? I mean, I'm just going to go out on a limb and say, heck, if I could get a body paid for at Borrego, I'd make sure that somebody was knocking on Daniel's door the next day. And this is a key element that I think we often forget. Is you know, Dr. Barber and I for our stuff, we don't exactly get the chance to leave the clinic. We've got a lot of stuff that we have to do. So having somebody who can do that, who can help with getting that paperwork filed, help with arranging transportation that might be able to handle that kind of a situation. That would be a huge benefit to the patients and the population as a whole. And especially if we do expect this to continue to remain getting out of hand, since we aren't able to get in front of it. And we recognize that. That's the thing. And the simple truth is nobody has the funding right now to do it. So I'm asking, can the county back that up? Can the county support that?
I can start on that, and then if Misty, Kim, others wanted to chime in, we have worked very closely with community health workers for COVID, and have also been providing information to community health workers about monkeypox, but it's been more so in an informative way, giving information. So if they hear of people that have monkeypox, if there's people that ask them questions, that they would have that information. But it sounds like what you're suggesting is more like, I saw in your chat, is more like patient navigators. And so it's not exactly patient navigators, but we do have disease investigative teams that help with some components of it. But I think, you know, what you're talking about is something a little bit more involved that can help with making sure that that people get the treatment that they need, or they go to the places that they need to. That kind of coordination that's a little bit higher. I know some healthcare institutions have it, but I can certainly bring that back and see how we might be able to meet that need.
Dr. C, maybe I can jump in here. So I think, you know, first and foremost, we hear you loud and clear that there needs to be more help for folks. And Daniel, I would echo just the thanks for you being willing to share your story and your frustrations. I know that is not easy. And so, yes, I will commit to this group that we will go back as a county and look and see if we can find the resources. Well, let me say this, we will figure it out to find some resources so that we can have at least a person or two that are dedicated to doing that kind of work. So yes, we will take that back. We will figure out a way to make that happen. If anybody wants to partner with us, we would love to hear that. We do have a lot of, as Dr. C mentioned, lots of CBOs and FBOs that are working with us. And so we might be able to partner with them as well, but we will definitely make that happen.
Maybe some MFM promotadores or something like that.
Exactly. Yes, exactly.
I just want to point out, if you need help in figuring out what their role is, let me know. As I think a few people here know, I have 4 navigators that I work to death, and I have no shame in saying that. They'll all hate me for it, but
thank you, Dr. Dorsey. I appreciate that, and we will definitely reach out.
Okay.
So there was a question about the guide, and I see Jennifer just responded to that. But is there any way to post these on the monkeypox page of the county's website? I know people have said they looked at it. There's not a lot there. They don't see the vaccine sites listed. So is that being updated?
Yes, we were trying to work on the translation of the document before posting both of them, but we can start with posting them. And then I also said I could email it to you, that you can circulate it as well. But it is planned to be on the website.
Okay, yeah, if you'll send anything like that to me, we'll post it on the HARP website.
But I may adapt it a little bit, because just from what Daniel mentioned about some of the sleep concerns, some of the mouth sores, I'm going to take that back and think of, what other kinds of symptom management strategies we can incorporate in there. And similarly, I think it can be, a document that can change over time, because there might be other symptoms that people experience that then I can, look back in the literature, review, see what other symptom management strategies can be added there.
Terrific. Thank you so much. And I see a hand up from Timothy. Go ahead.
Thank you. This is kind of a selfish question here. I've managed to make it through the COVID epidemic without getting COVID. I worked with the public in a hotel, not in Palm Springs, but I don't see me getting the vaccine anytime soon. While I'm long-term HIV and have hemophilia, which are sub-cohorts, what do I need to be concerned about here and now? I'm checking in people. I'm wearing a mask, using hand sanitizer, but I'm handling their credit cards and handling their pens. And, how transmissible is this? I'm hearing of trainers not going to the gyms now because they realize the gym could be a bad place. What are you telling people like me? I need to work but I could quit if I think this is really exploding. You know, what do you kind of say to people like me?
So again, I could start on this and then Misty might fill in because we've been collecting resources also on cleaning and disinfection. And so she might be able to talk a little bit more about that. But in terms of for those, working day to day, what the recommendations are, it's washing your hands regularly. It's the same kinds of recommendations that actually we've had for other infectious diseases as well. That doesn't change. So the mask, the washing hands, things like that. It's really the prolonged close physical contact that seem to be spreading it. Of course, it is possible through objects as well, but it's more things that are seeped in with the fluid from the lesions or that have been in contact with the lesions for a prolonged time. But something like a doorknob or a credit card or something like that is not something that has been found to spread the virus, and it would be considered a low risk. And I think in that also so certainly we'll go on continue answering that question and talking about disinfection of things. But I also want to mention that this also comes into the questions and areas about stigma around people that have monkeypox and things like that. And I know we went through this with HIV and AIDS and other things too. And so there are basic ways to keep your wash your hands, things like that, but it's not a dirtiness. We don't need to be scared of being around people in terms of things being spread via there's questions about respiratory droplets. A mask certainly would provide protection, but again, that's close face-to-face kinds of contact with a person, not just casual conversations at a front desk. And so from that standpoint, people working that are customer facing, that's not a medium risk, not a high risk, not even a low risk in terms of exposure. So
are you guys reaching out to all the hotels where there is action and no action in the gay community? Because the poor housekeepers, a lot of them Spanish speaking, only Spanish speaking, they need to be probably wearing gloves, and doing some basic remedial stuff. And I am working, I'm just at the front desk, but I know the housekeeper here, and I said, watch out for this, be aware, this is something you should keep track of. Are you guys doing any outreach to, those poor housekeepers, they're just exposed to so much anyway. But okay, well, thank you very much for you all. Thank you, Jeff, and all the professionals here. I really appreciate hearing from you and Daniel. All I can say. Thank you.
Thank you. We've got about 5 minutes left, so I did want to circle back. We were talking about who's vaccinating now, and I understand there's some more vaccination sites coming online. So if you'd like to speak to who those are, and then kind of what the plans are to roll that out, so there are more places where people can go, especially those who don't have a regular healthcare provider and they're not part of the system. So they're undocumented. Those folks who currently don't seem like they have much access.
All great populations to try to reach out and support, of course. So what we have currently been doing is having again. Oh no!
I'm gonna stop your video and see if that helps your bandwidth. So we'll imagine your lovely face and see if that improves the audio.
Hey, Jeff, I'm switching routers. I apologize.
No worries.
I turned my camera off also. Hopefully that is better.
Yeah, it is.
So, okay. So with the vaccine pieces, we've been reaching out to providers on the western part of the county, and in addition to continuing to support California Immunization Registry enrollment for providers in the Coachella Valley. The goal would be additional allocations to existing providers so they can keep their work moving and an expanded net. We've had active conversations with Dr. Ritchie, with Kaiser, as well as with UCR to navigate with their clinic system that helps support both the Desert Care Network as well as several focused outreach medicine teams to assist both in the transient population as well as pop-up free clinics throughout the county. And we have expanded some conversations with a couple of infectious disease specialists on the west end part of the county so that we could get vaccine out to them, in addition to sharing Tpox information. And our RUHS EIP clinic has come up online to support their work in Central Riverside as well as Paris for the HIV positive population that we support through those clinic services. And we're anticipating, as Dr. Aragon mentioned, the vaccine additional allocations this week that will help me drive further numbers with how much more we could expand beyond that. Once we have signed MOUs and have those providers up on board with storage and handling, happy to share the additional provider names. But we are working within our own clinic system to navigate for the uninsured, underinsured pieces as well.
So locally, that would be the RUHS clinic on the corner of Sunrise and Talkwitz.
That's right. Yes.
Okay.
Yes. We've looked at some of our busiest clinics with support. We have strategized around, but not confirmed areas like Harupa Valley, which is a very busy clinic site for us, Palm Springs, and then also Indio, the clinic off of Oasis that's there.
Great. And do we know, have you been hearing anecdotally if there are cases spreading at all in the homeless community? We have a growing homeless community here who are, of course, extremely marginalized. And also the migrant camps. I know it's going to be grape picking season soon. We're going to have a big influx of people in the eastern end of the valley. And, you know, they often live in close proximity, you know, in trailers or campers or in tents. And is there any surveillance of that population to get a sense if cases are popping up and a plan to protect those really marginalized populations as well?
It's definitely a population that is of higher risk in the congregate setting, as you've mentioned. So there has been some focused messaging through some of our outreach efforts with CBOs and FBOs to help navigate that piece. And then we have also been trying to work with the Coachella Valley Volunteers in Medicine group and several other pharmacy to help with outreach pieces to both the transient population, the migrant farm worker, and all of our farm workers, both the east and west. And then we are working with Barbara has done some education and work with our housing authority partners to support the efforts for the transitional housing programs and shelters that we have throughout the county to provide them with education and awareness, both for intake as well as resident support for those patients. Now that does, of course, leave us to find some patients that might not otherwise engage in any of those networks. So it's not a very, you know, I think we need to continue to both broaden but also tighten that net of support. So we do have teams that are trying to go out weekly on Tuesdays, like the Coachella Valley Volunteers in Medicine and others, to reach patients that, you know, so we can find them where they are and provide support and then get in for testing and additional treatments as may be needed.
Terrific, thank you. We've got about 1 minute left. I see a question from JP. Do you have a brief question you can ask that you wanted to ask, JP?
Very briefly, how much support is there for contact tracing and epidemiology versus currently for COVID or was during COVID, especially in areas like ours with a high population of MSM? Thank you.
Not one single person has asked me how I thought I got it. Not one single person has asked me who I might have shared it with. And I've talked to dozens of people at Eisenhower, at DAP, and just, you know, support people that I was supposed to call. Not one person has asked me anything. Not Barbara, none of her team. No one has asked me one single question about who I've been with, who might have gotten it from me, where I might have gotten it and how.
Let the county respond to what their procedures are, or plan procedures will be going forward. Thanks.
Yeah, maybe I can start and others can chime in. So Daniel, that is not acceptable. So we will circle back and, look at where that breakdown occurred. And so, I certainly apologize to you because that is an important piece of the puzzle. I think, to directly answer the question about comparison of resources available for COVID versus this, if I look at it on a dollar for dollar basis, we've received $100 million for COVID response and then some, and we've received zero for monkeypox response. However, having said that, as your health department, our commitment to you is that we're going to find the people to do the contact tracing and case investigations. We do have people that are trained in doing these kinds of case investigations and contact tracing. So we have the resources. If we have to redirect them from COVID or from something else, then that's what we'll do, because it's important that we, as you all have said, get out in front of this. So we'll circle the wagons and relook at our processes, but the resources are there, at least to deal with, this volume and increasing volume. If we get into huge number of cases, then, we would be looking at a situation similar to what we saw with COVID, where we had to, basically double the size of our health department in a matter of, months. So, but that's something we'll be closely watching and making sure that we have the resources we need.
I have done my own contact tracing, but have those people, who knows?
Right. Yep.
Thank you. I think we're lucky that, this is happening in the MSM community, and we're unfortunately familiar with how these things work, and, I think commendably responsible and, doing all the right things. So we look forward to partnering with you to make that better. See hands up from Barbara, and then.
Now, let me just add, the standard is whoever is interviewing the patients should be asking about contacts, getting a list, following up. Also, we elicit names of contacts who have an exposure so we can refer them for vaccine. So Daniel, sounds like you were missed. My apologies as well. Our procedure is to ask not only who you've been around, who might have been exposed, who needs to be evaluated, who needs that post-exposure vaccine, but also to say, do you have any idea of where you might have contracted it? I must say, most people share they were not sure because maybe they were at, let's say, a sex party. They didn't have names. So sometimes it's hard to get the names, but we should be asking. So it sounds like you were missed. That is not our standard procedure. We do ask those questions. So again, I'll add my apologies that wasn't done, but we do routinely ask. We're also doing follow-up calls, trying to do follow-up calls to see, are people recovering? Are they feeling better? There should be a discussion around Tpox. I know you're feeling all of that was missed. You and I had a discussion of my next steps to try and help facilitate the Tpox for you. So we're catching up, and I will make sure anyone that's calling follows the process, because we do have that as our standard procedure. Thank you for sharing that.
Thank you. And then a follow-up to contact tracing. So if people have online contacts, say through Grindr or something, and all they have is a profile name, is there a way to reach those folks through the online apps that many people use?
I wonder if I can first, respond to something about contact tracing, and then also.
Go ahead. Yeah.
So one of the other things, I think it points out a good point as well. I just want to make a comment about, the volume of, calls and messages and things that we're getting in that we're prioritizing and sifting through. And part of the challenge at times is, prior to a lab report coming back or confirmed diagnoses or something like that coming back, it's the contact tracing. I guess it shows that it needs to be more upstream. And at the same time, when we have, a number of different, reports coming in at the suspect stage, that we could start gathering that information, which we have tried to do, but prioritizing those that have come back as positive cases or on lab reports, But I just wanted to say that we can continue working upstream on that to ensure that that happens. In terms of reaching out to on Grindr or other kinds of apps, we're willing to be creative with you. So if there is a way to pass on a phone number or ask a phone number via that we can then contact through, or if you have any other kinds of ideas about how we might be able to reach out, let us know. But I have not, I know in a number of those apps, probably it's not easy to necessarily get a phone number or a name, but any information that you have that you are able to share that we can help with piecing together, particularly any way of contacting the person, we can, contact via that means.
I'm old fashioned. I have the phone number of everyone that I've ever been with.
You're the model patient.
But no one's asked me for one single phone number. Not one person in all the people I've talked to has asked me, except one lady at KSQE, one of the stations, who have actually been reaching out to me at this point. Asked me if I thought I knew where I got it.
Well, thank you.
Not one single healthcare provider has asked me a single question about where I got it or who might have gotten it from me.
Well, hopefully tonight's call will help change that, and both for you and then kind of move the needle and improve the processes. I would like to say a huge thank you to the county health department, who's been on the front line for 2.5 years now with COVID, and then had this blow up in their faces. And as we've been hearing tonight, have not had the support we need from the state and the CDC. There's, from the top down, there've been a lot of blunders. And, I think once we can start resting easy after vaccines are out in the community, we can do some Monday morning quarterbacking and go back to see kind of where the failures have been for CDC. FDA bears a portion of the blame for not making the vaccines available from the plant in Denmark. So there's a lot of blame to be shared, but I think this has been a real kind of stress test of our surveillance systems and public health system. And I think, as we can all agree, did not pass with flying colors. So I think there's a lot of room for improvement. So hopefully this will spur a larger debate that can keep this from happening again, because I think we're all frustrated. I see some more things popping up in the chat all of a sudden. Public tracing. So Leah has posted Leah Morgan from the county has asked, can share more information about Grindr. CJ Toby from DAP has joined and is talking about reaching out to their sex workers, PMP, group sex participants via Grindr, and got them vaccinated today. That's terrific. Thank you, CJ. In addition to a list provided other community leaders in the sex worker profession. So he suggests using apps to reach folks. I think we all agree that that's where we are right now. And then Akashdeep Singh, we're responsible. I'll let people read this. I don't need to read it out for everyone. So Dr. Adams from Kaiser asked, what do we have to offer folks who have been exposed but are not showing symptoms yet? What do we do with those folks? That's a great question.
Refer them to us for post-exposure prophylaxis if it is a confirm, if they have been exposed to somebody who is confirmed and they're within the first 14 days of their illness. If they've been exposed to somebody who's a confirmed or a probable case, if there is known exposure, close intimate contact, please do refer it to us so we can facilitate post-exposure prophylaxis. Or if they, I know the different sites are also doing some post-exposure prophylaxis as well. So you can also contact those different sites, but we are continuing to do high-risk post-exposure prophylaxis for people with confirmed exposures.
And Dr. Shavinsky, this is Dr. Adams. Hi. First of all, thank you guys for your tireless efforts. I know that some of these comments don't seem like we're, very grateful for all the hard work that you guys are doing, but we are, and we realize how difficult this job is. So thank you, first of all. And back to that question, when you say refer to us, do you mean just call the number that's on the Monkeypox County website first? Is that the first step that we should do, is just call that number?
Yes, you can call that number, or we can also follow up with you offline if you have a patient that has a known exposure to a confirmed case, and we can coordinate and discuss.
Okay.
So the phone number is the right route, but seeing as you brought it up, I want to make sure that that nothing gets crossed. So.
Okay, thanks so much.
You can put your email in the chat.
Oh, sure, no problem.
And you mentioned, post-exposure prophylaxis for confirmed cases. I think as we've been hearing tonight, it takes a while for things to get confirmed. What about probable cases? Somebody shows up, they've got lesions.
Confirmed or probable, and just
Okay.
sometimes those words get a little bit like hard because they're epi speaks, so a little bit hard to understand. So when we're talking about confirmed, what that means is that it went on to the CDC and they confirmed the test, but we're acting prior to that, at the time, ideally at the time that we hear the report, but if not at the time that we hear the report and it's in the process of being worked up, at the time of getting the positive test from one of the either the San Bernardino County lab that we send it to, or via LabCorp, Quest, any of those other labs. So that would be still fit into the probable category. So that still is included in post exposure.
Okay. Thanks for clarifying.
Sure.
Okay, we've gone way over again. This seems to happen. So thank you, everybody. And we had over 110 people at the peak of the call. And so I think, this really helps get the word out. And we had some really useful dialogue, and it was great that the state was on and Dr. Aragon was able to hear what we had to say, and I think really took it to heart, and hopefully that will result in making some changes as well. So thank you all for joining us. I know it's late in your evening, and the county folks have had very long days, and they're probably not over yet. So thank you again for taking the time out to engage with us and work with our community, and we'll keep these going. These community town halls will be ad hoc. The task force calls will continue to meet weekly as they have been, because I think there's a lot to cover. I'll circle back with the county folks to see if we need to have one this week, since we just had this call. I know I'm going to be out of town, so I might have to delegate to someone else to run the call. But if they think it's needed, we'll make sure we have them, because it's been a huge help, kind of grappling with all the issues that have been coming up with this. So any other last words or questions before we go? If not, thank you all. Have a wonderful evening, everyone, and stay tuned. And this will be recorded. I think I missed the first few minutes, but we'll see if we can patch that back in and post it on our HARP YouTube website. And if the county folks want a copy, let me know, for the stuff in the chat and so forth. I can share that with you if needed. So thank you, everyone. Have a wonderful evening.
Thank you.
Take care.